Hi everyone, I'm Dr. Casey with Birmingham Health, and today in this quick video I'm going to go over with a couple of things I think you'll find some value in for people especially that's had any type of auto injuries. One of the first things that we always want to do when things like that have occurred, there's some soft tissue injuries that have occurred, but we also want to make sure there's no real structural damage done. And so the first thing is that when our patients come in, we always want to do some type of digital x-rays to make sure that nothing's really happened to the bones, whether it's type of fracture, or any type of ligament damage that causes a lot of types of instability to different areas of the spine that can cause you further harm. Once we kind of find out that things are okay for us to begin treating, what you'll see is that a lot of these regular soreness and regular painful areas that just don't really go away, we'll start chipping away at that by doing some different types of soft tissue therapies, and that's going to include traction, electrical stim, ultrasound, and once we get those things back under control, we're going to graduate into more of some of our strengthening exercises that we go through. And what we start seeing is after a couple of weeks that we start seeing these things to finally get to a point where you're climbing out of that hole where you don't feel like that you're ever going to get any better. Our patient that started with us a couple of weeks ago never had really any type of back pain, neck pain, or headaches before her accident. And her accident has actually brought to light some of the things that had been going on with her previously. And we took some spinal films to figure out and make sure that all those areas were safe to treat and manage. And we found a lot of degenerative areas, and I said, hey, you sure you never had any type of back pain before? And she was certain that she never did. And that's all okay. And all I just tell people that have had type of degenerative changes in the accidents is that this might be something that might be a little more reoccurring because it was a weaker area. And now you may be more subjected to future symptoms because now that weaker area has some permanent damage to it. And so just kind of giving people an open idea of what to expect down the road. But once we started taking care of that, these daily headaches that she started having finally started to go away to the point where she didn't take any more over-the-counter medications. And she really never wanted any type of prescriptions, but she didn't feel the need to take any of the type of muscle relaxers or prescribed anti-inflammatories that she was given. And so one of the first things that we always assess is make sure, one, is it safe to treat? And if it's not, we're going to get you to the right professional. And then two, if it is safe to treat, we're going to give you the most effective treatments to help you begin getting better so your quality of life begins climbing immediately. If you have any questions about any type of accidents that have occurred and where you've had any type of aches and pains or delayed soreness or immediate pain, we'll be happy to answer any questions that you have. All you have to do is give us a call at the clinic at 205-385-9999, and I'll be glad to answer any questions that you have.